morning.
Alcohol, please.
Thank you.
Okay, could you please state your name and your birthday?
My name is Gerald Irizarry. I was born on November 5, 1998.
How would you like me to address you?
Gerald.
Yes, sir, Gerald. Okay, so this is just a safety check just to make sure that I got the right patient. And yes, I do. Thank you for that. Okay, my name is Geraldine and I'm one of the student nurses here. And today I'm going to ask you a series of questions about yourself and a bit of history, which will help us for assessment of your health status. And while I'm asking you questions, I will be taking down notes for later verification, but rest assured that the information you'll give me will remain confidential. Is that okay?
That'll be okay.
Okay, so let's start first with your personal information, shall we?
Yes.
Okay, so how old are you?
I am 23 years old.
23 years old. Okay, so where do you live? Are you living with your parents, siblings?
I live in Cane Town Subdivision, Victoria City. And yes, I live with my parents.
Okay, so what brings you here today?
Well, I've been quite sick for a while and I was having coughs.
Coughs. Okay, so when did your cough started?
Around 3 days ago.
3 days ago. How long has it been?
It's been almost 4 days.
4 days. Okay, can you rate your cough from a scale of 1 to 10, 1 being the lowest and 10 as the highest?
It's 7.
7. Okay, so how are you feeling generally today?
I'm quite not feeling well.
Okay. So, are there any things or factors that triggers your cough?
Probably the weather.
The weather. Okay, so what do you do when it occurs? Do you drink water, medicine?
I used to drink both.
Okay, so what makes your cough worse? Eating something or
Probably eating something.
like what?
Preferably the sweets.
sweets? Okay, so what do you do to lessen the pain? Do you rest?
I rest most of the time.
So besides your cough, do you feel any other discomforts?
There's none.
None. Okay, so do you have any fever or how about chills?
I quite have the fever. That's the reason why I feel unwell.
Okay, so do you have trouble sleeping?
Yes.
Okay, so let's go to your past history, sir. So can you recall when you were a child? Do you have any problems at birth?
There's none.
No. Do you have any some childhood illnesses?
There's none.
None also. Have you experienced chicken pox?
Yes.
Chicken pox.
Yes.
Okay. Did you have any serious injuries that leads you to be rushed in the hospitals or some accidents?
I have none.
None. Okay. Do you have any surgeries back then?
I have none.
None. Did you have any immunizations when you were a child?
Yes, I had.
Yes. Can you remember what immunizations you took?
Probably for immunity.
Immunity. Okay. Have you ever been to the hospital again, except when you were born? Went for a checkup or consultations?
I've been to the hospital because I was vomiting a lot.
Vomiting a lot. Okay. Are you allergic to something?
Nah, there's none.
Okay. So do you take any medications recently?
Probably vitamins.
Vitamins. Okay. When do you drink your vitamins? It is in the morning, in the evening?
It's in the morning.
Morning. Okay. So are you up to date on your vaccines or immunizations?
Yes.
Yes. Okay. So how do you start your day? Do you do stretching in the morning?
I do a little bit of warm up and biking.
Warm up and biking, outdoor activities. Okay. Do you do diet?
No.
No. Okay. How does it feel when you go biking? Does it lessen your stress?
It lessens my stress and hypers up my adrenaline.
Okay. So do you sleep early?
Yes.
How about sleep at ease?
Yes.
How about sleep late at night?
Sometimes I used to sleep late at night if there is some extra work.
Okay. Do you eat regularly?
Yes.
Do you skip meals?
No.
No. Okay. What type of foods you usually like to eat? Do you eat healthy foods?
Preferably fruits and vegetables.
Okay, fruits and vegetables. Do you smoke?
No,
No. Do you drink alcohol drinks?
no,
No. Do you listen to music every day?
yes,
Do you have any problem in doing such activities, like moving around?
there's none.
None. Okay, so let's go to your family history. Do you have any family member or relatives that has a disease or any illness right now?
Probably my dad, he had diabetes.
Right now or before?
It was way before.
Before. Okay. Do you have any genetic? Is that diabetes the genetic condition that is known to be present in your family?
Yes,
Okay. Do you have someone in your family that has asthma?
no,
How about cancer?
no,
Any mental disorders?
no,
No. Heart diseases?
no.
No. Okay. So how is your relationship with your family?
Healthy and going well.
Healthy and doing well. Do you work or you still go to school?
I still work.
Okay. What is your job right now?
A programmer and graphics designer.
Okay. Can you tell me about your hobbies?
My hobbies are outdoor biking, drawing, graphics design, and photography.
Okay. So when you talk to other people, what language do you use?
I preferably use the native language.
Native language. Hiligaynon.
Yes.
Okay. So do you know any other languages?
I know Filipino and of course English.
Okay. Do you participate in any organizations or programs?
No, there's none.
Okay. Do you have someone who can be your support system?
Probably my parents, relatives, and my co-workers at work.
Okay. So, what is your religion?
Catholic.
Catholic. Okay, so you go to mass every Sunday.
Yes.
Okay. Do you participate in any religious charity work or
No.
programs? No. Okay. Do you have any spiritual beliefs that influence your medical decisions?
None.
None. Okay. Do you listen to religious songs?
Yes.
Yes. Okay. So, do you have any mental disorder
None.
or conditions, like depression?
There's none.
How about insomnia?
None.
None. Okay. Do you feel down sometimes?
Yes.
Yes. Do you experience nightmares? How about
None.
delusions?
None.
How about hallucinations?
None.
None. Okay. What lifts up your mood?
Probably listening to music and watching television series and movies.
Okay. Do you have short-term memory loss, or is it hard for you to remember something?
Sometimes I had short-term memory loss. I forgot sometimes.
Okay. Sometimes. Is your mental health okay?
It's all okay. It's all going fine.
Okay, so that's it for the interview today. So I'm just gonna call you for another interview, or are there any tests that will be given to you? And so thank you so much, Sir Gerald, and thank you for being so responsive. And have a great day ahead, and keep safe always.
Thank you very much.
Okay, thank you.